Welcome back. Well, singers like Beyonce and Jennifer Lopez have brought back the fuller hourglass figure, especially when you see them from the side.
Absolutely, but for those who aren't naturally, say it with me, bootylicious. I've never felt so close to you. There's a new way to enhance your assets, so to speak. Our health specialist, Beatrice Politi, with what's being called the Brazilian butt lift. Really? Good evening.
Indeed. Good evening, Leslie and Ann. It's so named because the procedure originated there. Until recently, if you wanted the lift, you needed to get implants. Now, you'll get the lift, but it's all you. A warning for our more sensitive viewers, some of the images are a little graphic.
Thank you.
In a little while, sitting down will be a whole new experience for Justina.
I've got a fairly flat butt. It's been bothering me. I'm very self-conscious about it.
For years, she's been thinking about changing the contours of her backside.
Really, that's what it, I think, boils down to for me, is self-esteem.
So this surgery involves very little cutting, just little poke holes.
It's called a Brazilian butt lift.
The principle is we take fat from some parts of the body and transfer it somewhere else.
First, the patient's body is marked.
And I'm just looking for areas that have nice pockets of fat that I can take and sculpt.
The fat is then liposuctioned or removed from those areas, and it goes into this canister where gravity brings the fat cells to the bottom. The fat is then pulled into syringes and injected into the patient's bottom. You can see the difference here with the left cheek.
There's a risk that you may have some asymmetry between the right and left side. Some of the fat may not take. In my case, I tell my patients about 15 to 20% of the fat that I inject doesn't stay. It'll eventually resorb.
Here are some before and after photos.
The key thing with this is that there's a lot of shaping going on. We contour the body. We don't just make the butt or the breasts bigger, we shape them.
Justina has been lying around on her stomach quite a bit. After surgery, you're not allowed to sit on your butt or sleep on your back for a couple of weeks. Justina's anxiously awaiting the final results, which take about 3 months.
We have the wedding to go to in a couple of months, so it'll definitely be one of the dresses that I was never able to wear before, more fitted and tighter around the bottom. So it's definitely something I'm going to be looking for in a couple of months.
The difference between this type of surgery and an implant is that you're using your own tissue and are likely to have fewer complications. The cost is anywhere between $4,500 to $8,500. Now, if you don't want to pay that much money, for about $20, you can buy these. These are called Booty Pop.
Booty Pop.
And they're padded underwear.
And Roskowski tried.
She did.
I tried them on.
There was some modeling going on in the newsroom earlier.
And what did you think of them, Ann?
I have to say they were sort of enhancing parts of my booty that I don't want enhancement for. They were sort of high, and then there was a dip, and then my own booty. So I would think that, you know, if you were to wear a clingy dress, it might be kind of awkward.
Your shoulders never looked better, however.
Anyway, cheaper option.
Cheaper option.
Cheaper option.
You know, exercise. How about that? Lift the booty that way.
She really couldn't sit down for 3 weeks?
Exactly. That's one of the downsides of having the surgery, right?
Okay.
Because if you sit down, you're going to move things around that have been injected. So
I got that picture. Help me out here, Ann.
I just can't.